listening to Fertility Empowerment Podcast, and I'm your host, Panta Kalho. If you have any problem with fertility issues or trying to conceive, this is the right place to be. Today, we are talking about childhood trauma, hormone imbalance, and fertility with Dr. Janelle Louis, Naturopathic doctor. Please subscribe to Panta Kalho Transition channel and order my book Naturally Conceived through Amazon. Thank you for watching. Dr. Janelle Louis is a licensed naturopathic doctor who specializes in helping people who struggle with stress and anxiety events during their childhood. And she actually helped them to overcome their problem with the reproductive concern. So I have her here. She's going to talk about how childhood traumas can affect fertility issues. Welcome to my show, Janelle. I'm so happy to have you, and I'm so grateful to have naturopathic doctor in this show because I know this field is not really known for everybody, and I just want to make an awareness to introduce you because I know you are doing amazing jobs with this field. And I really wish to know more about you and your job and what you're doing exactly.
Okay, thank you so much for having me. I'm so grateful for the opportunity to share with your audience today, and I'm looking forward to it.
My pleasure. All right. First, tell me about yourself. Why did you become naturopathic doctor? I know this field is still unknown for everybody. I just want to have more awareness about it.
So I actually first became interested in naturopathic medicine because my mom had some struggles with her mental health. So I grew up in an environment where my biological father was chronically unfaithful to my mom. So he cheated on her a lot for many years. And it led to my mom having significant anxiety, depression, and panic attacks. And so she eventually divorced my father, and we moved to the United States. I was born in Trinidad, so I grew up in the Caribbean. But when she moved to the United States, she still had these residual effects. So her mental health was still affected by the things that she had experienced. And so I was with my mom, and she ended up being put on 3 different psychotropic medications. And she came to me one day and she said, you know, Janelle, I've noticed that while I'm on this medication, I'm experiencing more anxiety and panic attacks than I was experiencing before I started taking the medication. So I want to get off of the medication. So I went with her to see her psychiatrist, and he wasn't happy about her wanting to get off of the medication, but he eventually told us the weaning protocol. Long story short, she tried to wean off of the medication. She was able to get off of the first one, but the second one, she wasn't really able. She ended up in the ER with stroke-like symptoms. Wow. And we later learned that they were withdrawal symptoms. So that I had always wanted to be an allopathic physician actually, but that kind of led to me really reconsidering the trajectory of my life. And so I started thinking like, is this really what I want to do? And around that same time, I met someone who was a naturopathic physician, and she told me how she works with the body instead of against it, and how she tries to support the body so that the body is better able to, when you give the body everything that it needs, is able to respond to that improved environment, and then healing comes about. And so I really resonated with her methodology. And so that's what led to me looking into naturopathic medicine. And then that is what eventually led to me becoming a naturopathic doctor.
Wow. So did you help your mother?
Yes, I did.
Yes.
Yes. Yes. So sorry, I forgot that part. So she was eventually able to get off of all 3 of the meds. Wow. And I was able to help her to manage her anxiety and depression to the point that she's not depressed at all. And she's a teacher. So at the beginning of the school year, she does experience some anxiety, but she manages those using natural supplements. So she's not on any medication for any psychotropic medication now.
I'm really amazed. I
Yeah.
know the power of naturopathic, really, because you know your body can heal itself. And with the interference of drugs and medication, we try to um, imbalance our body somehow. And if your body have this power to get to healing points again, so why not? Why we don't use nature? Why we don't use the medicine that is already in the nature and doesn't need any chemical interferences,
Mm-hmm.
right?
Right.
So um, do you have any presentation right now to show us? I know you're going to talk about how childhood trauma affect infertility. I know about the infertility because I wasn't there. I was diagnosed with unexplained infertility. And then I realized at that point, when the doctor said that there is nothing else we can do for you, there are still other solutions, other things coming to help you, especially naturopathic or holistic medicine, whatever field you're thinking, like homeopath, acupuncture. I really, really believe in it. And I know that PTSD, because I'm PTSD coach as well, PTSD and traumas in childhood can really affect your body, because this is mind and body working together, right, as a whole to
Mm-hmm.
help you to heal. So if you have two patients, same diagnosis, one of them heal faster than another one. Why? Because the mind and body are connected, right?
Right.
Yes. Okay, tell me about it.
Okay. So, am I
Yes,
able to
I'm
share my
gonna
screen?
share. Yeah, sure.
Okay.
Yeah, go ahead.
All right. Okay. Can you see my screen?
Yes, I can.
Okay. All right. So I am going to just skip ahead here. So we've talked about that. So the things that I want to talk about today are, let me just move this. Okay, there we go. Exactly how experiencing stressful events during childhood can impact fertility in adulthood. I also want to talk about thyroid health and fertility in the context of childhood stress. And then I want to share a few of the recommendations that I typically make as a part of my balance framework to help individuals improve their thyroid function, fertility, and overall health in people who've experienced early life stress. All right. Okay. So early life stress can be thought of as anything that chronically elicits the stress response in childhood. So I'm going to talk a little bit about the way that this is perceived in the literature. And then I'm also going to talk about how it actually happens in our bodies. But for now, I want to say that anything that chronically elicits the stress response in childhood can lead to changes in our brains and in our bodies. And these changes can then increase our risk for over 30 different chronic conditions, including impaired fertility. So when we experience something acutely stressful, so let's say that we're just driving and someone swerves in front of our car, that leads to, like, you feel stressed. You're like, oh my goodness, what do I need to do? And you kind of get prepared to meet that stressor. So that would be an acute stressor. What happens then is, let's say the person immediately gets back into their lane, right? When they do that, the stressor resolves and then your body just kind of calms back down. So in something like that, acute stress, what we're thinking about is we're thinking about the sympathetic nervous system. And the sympathetic nervous system is actually stimulating the adrenal medulla to reduce epinephrine, also known as adrenaline. But when we're talking about chronic stress, we're talking about something different. What we're talking about is the Hba axis. So this is the hypothalamic pituitary adrenal axis, and this is what controls our chronic stress response. And when I say chronic stress, I'm talking about something that either happens repeatedly, so it's something that happens and that stresses you out for a prolonged period of time, or I'm talking about something that happens once and then the effects of it kind of continue to stress you out over time. So an example of something that happens repeatedly would be, let's say, for example, you're bullied every day that you go to school. So that would be a recurrent chronic stressor. Whereas if your parents get divorced, right, you think of that as they only get divorced once, but then the effects of their divorce can kind of stress you out multiple times. So those are the two categories of chronic stress that we're talking about here, right? So when you experience something that's chronically psychologically stressful, the hypothalamus secretes something that's called, that's known as CRH, so corticotropin releasing hormone. And then corticotropin releasing hormone then goes to the pituitary gland, which is also located in your brain, and it causes the release of ACTH. So that's adrenal corticotropic hormone, sorry about that. And then the ACTH travels to the adrenal glands. And so when it's at the adrenal glands, it's going to stimulate the adrenal cortex this time. So before with acute stress, we talked about the adrenal medulla, but now with chronic stress, we're talking about the adrenal cortex. So this is the cortex or the cortices of the adrenal glands, and they secrete cortisol. So cortisol is our main stress hormone when we're talking about chronic stress. Now, when we experience these types of, any type of stressful thing during childhood, it changes our brain and it also changes our body. And this is how. So let's say a person is chronically stressed in childhood because they are being bullied. Let's just use that example. Let's say they're being bullied. So what happens is that the body kind of says, hey, we were expecting for our stress levels or cortisol levels to be at a 2, but it seems like normal is more like a 5. So the body and the brain are still developing, so they're still kind of getting used to what's normal for this person. And so what it does is it just kind of says, let's just accept the fact that normal is more like a 5. And so what happens is you have what's known as Hba Axis Hyperactivity. So this leads to your cortisol levels, and in some people, not everyone who experiences early life stress has this, but many people do. It leads to cortisol levels being slightly elevated, even at baseline. So even when the people are not really stressed, so not significantly stressed, right? So this Hba axis hyperactivity is something that we see in people who have experienced early life stress. And this is problematic for fertility and for a lot of other chronic diseases or a lot of other chronic conditions rather, because of cortisol's ability to affect other body systems. So if you think about it, your body doesn't need, let's say you're running from a lion, right? You don't need to be fertile in that moment. You don't need to be able to have a baby at that time. Your body's job at that moment is to get you out of there, right? To keep you alive, to keep you safe. And that's what cortisol is doing. That's what cortisol does. And so in order to accomplish all of its purposes, so this goal of keeping the person alive, cortisol can actually change other body systems, right? So cortisol's effects, in order to properly do its job, cortisol can alter our reproductive system, our gastrointestinal system, our other endocrine functions, so things like your blood sugar control, things like that, cardiovascular system, so it can lead to elevated blood pressure in the long term. It can alter our immune systems and increase our risk for autoimmune disease. It can alter our nervous systems, and it can alter our weight control. So cortisol can really lead to changes in various parts of our bodies.
That's why when the medical doctors cannot find anything, they say that's because of stress. And it's true, because stress is root of many, many things in your body, yes.
Yes, it really does. And especially when you experience these things during childhood, because the brain and the body are just, they're so vulnerable because they're still developing. And so your body, it just can lead to these long-term changes that then can go with us into adulthood. And, it can affect us in various ways until we actually become aware of what's going on and take the necessary steps to address the effects of these.
Yes, I actually talked with one of the psychiatrist, and she said if the PTSD doesn't resolve in your adulthood, can show itself, even
Mm-hmm.
if you may not have problem for a long time, but there are a
Mm-hmm.
lot of triggers that finally can show up,
Right.
and then you can see the effect. The effect usually when you feel that you're not fertile or you
Mm-hmm.
have chronic disease. These are all back to unprocessed PTSD.
Right. Absolutely. I really, really believe that.
Mhm.
Okay. So the traditional view of adverse childhood experiences includes these 10 things, right? So we're usually talking about a 10-point scale. And for each one of these things, they are going to assign a point. So if you experience, let's say, 5 of these things, then they'll say, well, your ACE score is 5. So these things include abuse, so physical, verbal, or emotional abuse, and sexual abuse. And then household dysfunction, so things like your parents being separated or divorced, parent being in jail or prison, domestic violence, so violence among caregivers, substance abuse in the home, or caregiver depression or other mental health concerns. So these things constitute household dysfunction. And then we have neglect. So physical neglect, so not having the food, clothing, shelter, things like that, that every child needs to thrive. And then emotional neglect. So that would be like not feeling like your parents love you, or like they're emotionally available to you, or that they're there to protect you, things like that. So if you look at the research on adverse childhood experiences, you're gonna most likely see one or more than one of these different ACEs being looked at. But I believe that these are not the full extent of how early life stress affects us. Because if you think about it, the body doesn't say, if you're being chronically bullied every day, the body doesn't say, oh, you know what? Just kidding, this is not, this is really stressful, but we're not actually being abused at home. We're just being bullied by someone. So don't have HPA axis hyperactivity today. The body doesn't say that. The body doesn't really distinguish between the source of the stress in that way. And if you look at some of the newer research, it's actually looking at other things that can elicit the stress response outside of these 10 things. And it's really supporting this idea that people, regardless of the source of the stress, if a person is experiencing early life stress, then it really leads to this HPA axis dysfunction that I've been talking about. And so some of the other stressors that, I'm sorry, did you want to say something?
No, it's interesting for me. I'm just
Mhm.
looking at this categorization. And
Mhm.
as you say, yes, you cannot just limit
Mhm.
yourself to this. There are lots of things around it.
Mhm.
Yes.
Yeah, so my, some of the other things that I believe chronically elicit the stress response in a similar way, and the research supports some of these as well, are bullying, childhood cancer, poor communication in the household. So your parents never really telling you that they love you or things like that. Being raised in a war-torn country, the death of a parent or even of a sibling rivalry, if it's really intense, can lead to chronic stress. Um, Being an adoptive child and just kind of like wondering why your parents chose the route that they did, all of these things, being in a house fire, all of these things can really elicit the stress response chronically in children. And, they can lead to HPA axis hyperactivity. All right, so I want to talk about just one way that these HPA axis changes or these brain and body changes can affect our fertility, and that is thyroid health. So that's what I will spend the majority of the rest of the time talking about. So just like we had the HPA axis, we also have the HPT axis. So we have the hypothalamus, the pituitary, and again, here, the pituitary is going to secrete TSH, thyroid stimulating hormone, and then TSH is going to go to the thyroid, which is located in the neck, and it's going to cause the thyroid gland to secrete our thyroid hormones. The most potent one is going to be T3, and then we have T4 and other thyroid hormones as well. But when we have this hyperactivity of the Hba axis, it can also present as hyperactivity of the HPT axis or hypoactivity of the HPT axis. And I'll get into that in a little bit.
I'm gonna ask you some question about this maybe later. I'm not sure how you go further with these slides, but I've heard from a medical doctor, I had an interview with her, that thyroid, when you're talking about the thyroid, like regular tests, T3 or T4 or TSH, these are not really enough to diagnose your problem. You may have other like more holistic or more detailed test about the thyroid, because not everything is in medical can be diagnosed there, and you may need to go to functional medicine or somebody who has this ability to give you this test. Is that true?
Yes, and I'm absolutely going to talk about that.
Perfect. We are on right track. Go ahead.
Okay, so the thyroid controls our growth, our development, and our metabolism, and it also plays an important role in fertility and in fetal development. Now, if your thyroid is not functioning optimally, then that can lead to you experiencing having difficulty conceiving. It can lead to recurrent miscarriages. It can lead to less successful IVF cycles, and the research supports all of this. Okay, so I just want to look at a few studies that kind of talk about how early life stress can increase our risk for subclinical hypothyroidism. So in this one, or for thyroid disorders in general, so this one is about subclinical hypothyroidism. So the study says, our findings suggest that there is a substantial and clinically relevant increased risk for thyroid dysfunction during pregnancy among women exposed to abuse and neglect in their childhood. And this could potentially have adverse consequences for fetal brain development. So here, basically what they're saying is that women who've experienced early life stress tend to have higher TSH levels than women who did not, right? And I don't want any of your viewers to get stressed because of anything that we read here. I'm going to talk about, some things that we can do towards the end to help kind of mitigate the effects of these Hba axis changes and the other brain and body changes that take place when we experience early life stress. So just hold on.
I'm sure we will.
Okay. Okay, so and then this study here basically found that there is an 80% increased risk of hospitalization with an autoimmune disease, a T helper 2 type autoimmune disease. So that would include Graves' disease and Hashimoto's thyroiditis. So those are the two most common autoimmune thyroid disorders. So basically, people who had an ACE score of 2 or higher were 80% more likely to be diagnosed with Graves or Hashimoto's compared to people who had an ACE score of 1 or 0. And it says these findings are consistent with recent biological studies on the impact of early life stress on subsequent inflammatory responses. So here we see that, early life stress increases our risk for both autoimmune thyroid disorders and non-autoimmune thyroid disorders. And so it really affects the thyroid function across the board. And as I shared, impaired thyroid function can lead to impaired fertility. So this is highly relevant to us. Now we're going to talk about the TSH as a screening tool. So the TSH has a pretty wide range as far as the reference range is concerned. So the reference range is typically 0.450 to 4.500. Sometimes it can be as high as 5, but the most common range in the labs that I usually use go up to 4.5. But basically, when we look at the TSH, the optimal range is within that reference range, right? So even though if you have a TSH of 4, that is technically considered normal, the research shows that having a TSH that's that high, even though it's considered normal, will actually lead to thyroid symptoms. And so optimally, we want to see the TSH between 0.9 and 1.5. But I personally like to see it from 0.9 to 2. Okay, so 2.5 is still technically considered desirable, but I like to see it below 2 or below. So between 0.9 and 2. Go
So I
ahead.
have a question. Um, Again, I talked to that medical doctor, and she had the same issue with
Mm-hmm.
thyroid, and she said, my test always wasn't desirable, but was not optimal, and they couldn't actually show me that optimal domain. Can you this range optimal? Can you see it in all tests, or you have to have extra tests?
So what I do is I learned that this is the optimal range, and so what I do is I just run the regular TSH, and then I just look at the values and disregard their reference range, and I just know
Mm-hmm.
what I'm looking for.
Understand.
But as far as a test that shows the optimal range, I can't think of a lab company off the top of my head that shows the optimal range like that.
Okay.
Yeah. Okay, so I had a few things here that I wanted to show about just using the TSH as a screening tool. But now that I know that your audience has already seen this, I'll just kind of go through it a little faster. So this is the American Association of Clinical Endocrinologists. And here they said, even though a TSH level between 3 and 5 is in the normal range, it should be considered suspect since it may signal a case of evolving thyroid underactivity. So basically what they're saying is here is between a 3 and a 5, so a 3 and above is still within the normal range, but if someone is there, we should really be looking into other causes or trying to figure out if their thyroid function is really where it should be, right? Okay, and then we have this study, which says this is really interesting. So this says TSH upper reference limits may be skewed by TPO antibody negative individuals with occult autoimmune thyroid dysfunction. So what they're saying here is that when we came up with the normal reference range for the TSH, we may have included some people who had hidden thyroid disorders. And so because we thought they were healthy and we kind of like took an average of all the people who appeared to be healthy and came up with the reference range, this is ending up being problematic because now it's kind of like artificially inflating the normal range for the TSH.
This is reason for many infertility issues.
Mm-hmm.
I know that because I have clients with thyroid issues, and usually when they say, "Oh, my thyroid is normal," but when you look at the symptoms, then
Mm-hmm.
you say, "Oh, we are suspicious. You have to go and check," and
Mm-hmm.
then you see, no, they are not optimal. And
Mm-hmm.
exactly that's the point. In many cases, women even are not aware of this.
Yes.
But that's the underlying issue for many, many infertility. I'm not saying infertility. I don't believe in fertility. I'm saying that's unexplained fertility issues. And as
Mm-hmm.
soon as you have these thorough tests on you,
Yeah.
then you realize, oh, that was the problem.
Mm-hmm. Yes, I agree 100%. Yes. Okay, and I just want to take a moment to thank you for really raising awareness about these issues because it's really a breath of fresh air to see people, just informing people and helping people to be able to take control of their health and to, make the decisions that are best for them, because if you lack the information, you don't
Yes.
know what you need to do. And so
No,
I just wanted to
and
thank you.
general, that's the problem for this world right now is that you access to many, many information
Hmm.
and you don't know if they're valid or not.
Absolutely. Yeah.
Working with naturopath and all holistic medicine and medical doctors, I'm writing a book actually regarding this fertility issues and thyroid and everything.
Mm-hmm.
And I just realized that when I talk to these medical doctors, I just realized they know so many things, and uh, you cannot find this exactly through the web. you know, because you don't know exactly where to go and source them. I
Mm-hmm.
try to add extra resources, adding to their what they wrote for me,
Mm-hmm.
because we had interviews with them, and then I said, oh, I added this reference, and she said, no, I don't accept this reference because it's not validated. You see, there are lots of information back there, and you don't know which one really.
Yeah. Yeah. It's true.
That's the purpose. I try to um, bring real doctors, real naturopathic doctors, real holistic medicine, homeopath, because these resources are validated.
Mm-hmm.
You know exactly that's true. That's they have to go and find their problems, and it's much easier this way. When you have this knowledge, then you just go through your body, scan yourself. Okay, maybe I have this issue, maybe I have these symptoms, maybe I have to go through a full test for
Mm-hmm.
my thyroid.
Mm-hmm. Yeah.
Yep.
Let's see. Okay, so and then I had this one that I wanted to share as well. So the title of the study is Does TSH Reliably Detect Hypothyroid Patients? And they concluded this. They said, although measurement of TSH is a convenient screen for thyroid function, it is influenced by many factors which may affect its overall reliability. It says, we believe thyroid function should be assessed by more than a single test. And this is exactly what we were talking about. So I wanted to share the test that I do for patients where I suspect suboptimal thyroid function, and at minimum. So at minimum, I will do these 5 tests. So I do the TSH, the thyroid stimulating hormone, because it does give us valuable information. You know, it's just, I don't believe it should be done as a standalone test, right? So I do that. I do the free T3 and the free T4 to see where the thyroid hormones are.
Why
And
do you
in
say free T3, free T4? I've seen T3 and T4, but you added free. I don't know, because I'm not a specialist. Yeah.
Yeah, so some people do total T3 and total T4, but
Oh,
the free T3 are going to be the T3 that's not bound to proteins in the body. So this is
I
what's free.
see. That's
Mhm,
why. Okay.
mhm. Yeah,
Thanks.
no problem. So I do so I do the free T3 and free T4, and then anti-thyroid peroxidase antibodies and anti-thyroglobulin antibodies.
So
So
are they available in regular laboratories?
yes, they
Okay,
are. Hmm.
good.
But most doctors will not do them just as a screening lab, because people are still doing probably what they learned in school to do the TSH as a screening lab. And so people aren't really aware. I have actually had patients come in with all of the symptoms of thyroid dysfunction. And I do these labs and I discover that even though the TSH is still in the normal range, they have anti-thyroid peroxidase antibodies out of this world. So they have a raging autoimmune disorder, and that's why they're feeling so terrible. But if they had only done the TSH, they would not even know that their thyroid was the problem. They would think that their thyroid function was still, within the normal range. But what happens is you have the thyroid, you can see the antibodies first, and the body is really good at compensating. So the body's going to compensate and compensate and compensate until it can't compensate anymore. And then when it can't compensate anymore, that's when the TSH starts rising. So by that point, you already have a raging autoimmune fire that is going to be really difficult to put out, whereas if you just, if they have all the symptoms and you run the antibodies and you catch the autoimmunity early, then you can really address the autoimmunity so that they won't have to end up being on medication for the rest of their life.
I'm going to add something here. That's amazing that you as naturopath doctor do this test, because as awareness, not everybody know that naturopathic doctor have this availability, ability to order these tests.
Mm-hmm.
Because you always have this in your mind that only medical doctors can do it. So it's good to know.
Mm-hmm.
For my audience, this is naturopathic doctor, and she has amazing knowledge about this thyroid issues, and No, I actually had lots of research and interviews about the thyroid, but right now I can see it in my eyes that you can have like different tests and it's not really uh, confusing.
Mhm.
Even me, as somebody who doesn't have medical experience, I mean, I'm not medical doctor, but I can understand this because everybody know about T3, T4. I mean, with a little research, you can understand about this whole tests.
Yeah. So there are other tests that I might do depending on how the patient is presenting, but at minimum, these are the tests that I would do if I'm suspecting any, or if I'm just wanting to evaluate thyroid function, or if I'm suspecting that there may be something going on with the thyroid. Okay, so here is my takeaway for thyroid function. Suboptimal thyroid function can affect fertility. If your TSH is above 2.5 and you have symptoms of thyroid dysfunction, then be proactive about your thyroid health. Talk with your provider about your concerns and about running additional tests. While conventional medicine typically only offers treatment for overt dysfunction, there are steps that you can take to safely optimize your thyroid health using more integrative therapies before you need to resort to meds. So you don't have to wait until your TSH gets to 10, right? You can start taking steps right away to keep your autoimmunity at bay if that's what the concern is, or to just improve your thyroid function in general if it's, a non-autoimmune hypothyroidism or something
I
like that.
love it. I love it. Like, you know, I was thinking about this conventional medicine. Doctors do a lot of great jobs. They save life.
Yeah.
But the problem is there are lots of underlying issues that is not going to be diagnosed by medical doctors. And I had interviews with people, functional medicine practitioners.
Mm-hmm.
They had these issues of chronic disease for years. And after they realized they had this problem, they said, okay, I shouldn't have this chronic disease. It should have some root cause
Yeah.
at the
Mm-hmm.
back end. So when they realize which blood test they have to do, then they go and discover it themselves and order it to their doctors. Medical doctors were really surprised. How do you know about this? No, I
Mm-hmm.
cannot do this. So unwillingly, the medical doctor actually ordered this blood test. And wow, after 10 years, she realized, yes, that was her problem and she could discover this.
Mm-hmm.
So I think that's the point. If naturopath doctors and medical doctors, holistic medicine, they can work together, they can really save a lot of women's life, like
Yeah.
especially infertility.
Mm-hmm.
As I had the same issue, I know I was at that shoes. And as soon as I had my baby and hold her in my arms, I said, this is my mission. I have to help people.
Mm-hmm.
And because I'm not medical doctor, that's why I try to bring all of you to just um, give them this information that yes, you can find and discover, because there is nothing in this world as unexplained. Everything has explanation, right?
Yes. Mm-hmm. Yeah. I love
Yeah,
that.
great.
Okay, so then I just wanted to share a few of the recommendations that I typically make to to help people who've experienced early life stress to optimize their health and their fertility and all of that. So the first things that I want to share, of course, I just talked about this, is to get a comprehensive thyroid workup. Right? TSH alone is not sufficient. You need to get a comprehensive look into your thyroid function so that you can address any dysfunction that is there. Also, you want to get a comprehensive look into your reproductive hormones. So we're talking about things like estradiol, estradiol, AMH, follicular stimulating hormone, luteinizing hormone, so LH, FSH, all of those things you want to do. Usually those are done on day 3 of the menstrual cycle. And then you also want to do progesterone, which is usually done on day 21. Well, 5 to 7 days after ovulation. So if you don't ovulate on day 14, then, you just 5 to 7 days after you ovulate, whenever you ovulate. So you want to make sure you get an in-depth look into your reproductive hormones. You also want to look at your blood sugar control. This is really important because it can significantly impair fertility if you have insulin resistance. So you want to look at your fasting insulin, your hemoglobin A1C.
What is the HbA1c?
Hemoglobin A1C. So that's really just a measure of how well your body is controlling your blood sugar.
Hemoglobin.
Hemoglobin A1C, yeah.
Okay.
Yeah. And then your fasting glucose. So all 3 of those are going to give you insight into your glycemic control. And then you want to look at things that give you information about inflammation. So things like homocysteine, ferritin, and high sensitivity C-reactive protein. So those 3, well, ferritin is also related to iron, but ferritin can be elevated if you have high levels.
Ferritin is the same as iron, right?
It's related to iron.
Related to iron. What is Hscrp?
High sensitivity C-reactive protein. So it's what's known as an acute phase reactant. So basically, if this level is elevated, it's a sign that there's inflammation somewhere in your body. It doesn't tell you where the inflammation is. So it could be, maybe you have poor oral health, or maybe you have poor gut health or something like that, but there's inflammation somewhere in your body.
I give you a really good example. I had asthma.
Mm-hmm.
I mean, in the beginning, I didn't have asthma. I just had sinus effect.
Mm-hmm.
Effect. And then the doctor told me, I was like in 50s, 60s, 16-year-old. And the doctor said, you are allergic and these are the medication you have to take forever. And it's not going to be cured. And I said, okay, I'm not going to use it. So I threw them away. After some time, I thought I was healed. I was okay. Until like in my 20s, I was in university, and I changed to another country. My situation and weather was changed, and then I was diagnosed with asthma. Before that, I didn't have any asthma. So then I realized, still I know, I still have it. I still have asthma. I definitely go to naturopath doctor to actually find out why I have it. What is the root cause of this? Because my asthma is not always there. So whenever I have cold or the weather change, that shows. But these are the things that definitely had root cause. Even if you feel that you're allergic, even allergy, they may have some root cause. And my doctors, with allergic doctors, even they couldn't realize it. They couldn't know that what is the reaction, what is the allergy. So this one still for me is not covered.
Wow. Interesting.
So probably later we can, in another discussion, in another episode, we can talk about allergy and how we can discuss how we can discover the root cause of allergy. Is that okay?
Yeah, that's fine.
Great.
Okay, so and then also you want to look at the typical labs that you do every year when you get a physical done. So CBC, you're going to look at your blood, looking for signs of infection, anemia, things like that. So that's your complete blood count. And then CMP, comprehensive metabolic profile, you're looking at things like your electrolytes, your liver health, things like that. And then lipids, so you're going to look at your cholesterol. And that's important because, your body needs cholesterol to make your reproductive hormones. So you want to make sure that you have enough, but not too much, of your lipids. And then also vitamin D. So I think
these are the things you can order um, again, from laboratory, normal laboratory, or you have to go, because let's say me as somebody who doesn't have any like medical background,
Mm-hmm.
can I go there and say, okay, can you order the
Mm-hmm.
HbA1c or,
Mm-hmm.
or I have to go to naturopath doctor and ask them to order for me?
You can actually go to a direct access labs company and get all of these lab tests done without a doctor's note. So if it's a direct access lab company, they have a doctor that will sign off on it, and you just pay them the money and you can run these labs.
Okay, interesting.
Okay, so now when it comes to the interpretation, I highly recommend
That's the
working with
point.
someone.
Of course, I cannot.
Yeah.
Even, I'm looking at this as my audience, because
Mhm.
many of my audience don't have medical background,
Mhm.
so I don't understand really I cannot even read it properly. So
Almost the same. Uh-huh.
yeah, okay.
So any, I mean, direct access labs are really making it possible for people to take their health into their own hands now. So, I mean, I think it's good. Some people see it as it could be threatening, or it could even be dangerous if a person thinks that they know more than they actually know. But I think it's beneficial, and because
This is the
sometimes,
first time I've seen this, to be honest.
really,
Like, it's very, nobody just give you this information as you see,
mhm,
because probably they think that you don't understand about
yeah,
this.
yeah, maybe, yeah,
Yeah.
yeah.
Okay,
Okay, let's
go
see.
ahead.
All right. Okay. And then a few recommendations that I make to help people manage acute stress. So I have found implementing a morning routine to set the tone for the day, to kind of set the intention for the day, and help you decide that no matter what happens when you go out of that door, you're going to have a good day that day. Just really taking that time to prepare yourself for what you're going to face that day to be highly beneficial in addressing acute stress. I've also found using a planner to get organized and to reduce overwhelm to be highly beneficial in addressing acute stress. Other things that I found to be beneficial are taking time to reflect after each day and to express gratitude. I like to write down things that I'm grateful for. These things kind of support parasympathetic nervous system health, so they help you to they help combat that fight or flight. So they promote that rest and digest kind of division of the nervous system. And then eating a diet that supports optimal vagus nerve function. So the vagus nerve is a cranial nerve that controls the parasympathetic nervous system response. So it controls that rest and digest, and it also plays a very important role in inflammation. And the vagus nerve is interesting because research shows that high fat diets actually kind of make it difficult for the vagus nerve to do its job. So I typically recommend limiting high fat meals to 3 times per week at the most. And I recommend, really increasing your intake of fruits and vegetables and other plant-based foods, because I've found this to be extremely beneficial in promoting vagus nerve function, and this is especially important in people who've experienced early life stress. All
I
right.
like that.
And then as far as like chronic stress is concerned, I like recommending that people spend at least 20 minutes exposed to nature each day, because the research is showing that being exposed to green space really cuts your cortisol levels. It significantly decreases your cortisol levels. So
Not in Toronto. We don't have a green nature in winter.
so as much as you can. Okay, so
even
as far
even
as
the snow is good. Like, I accept it as nature.
That's true. I mean, being outdoors really is better than being indoors. But if you can be exposed to like the canopies of trees, um, so in the
Sure.
summertime, like that's really beneficial.
In Toronto, even during the minus 15, they have
Woo.
some degrees. Take the kids outside to play
Hmm.
in daycares. And I
Wow.
was really, how can you do this? Actually, kids have snow pants. they cannot even move,
That's so funny.
stress. Like my daughter last year was there. Like this year, because of COVID, I didn't send her. But this is a good practice even for them to have a better immune system,
Yes.
because they're living in this country with the snow and cold.
Mhm.
And but the point is, for a while she couldn't bear it, and she was sick all the time. But
Mm.
after sometimes they get used to it.
Yes.
So nature, even if, like, you're right, fresh
Mhm.
air give you a lot of great oxygen level, and thinking, you can think better.
Mhm.
There are lots of good things
Yeah,
for
lots
nature.
of benefits.
Yeah.
Mhm. Yeah. Okay, so and then with other things for chronic stress, for addressing chronic stress, is I would say consider adaptogenic herbs to modulate the stress response.
What
So
is
that would
it?
be adaptogenic botanicals. So that would be things like reishi mushroom, shiitake mushroom, ashwagandha is my personal favorite, rhodiola, schizandra. These are all botanicals that help to modulate the stress response. So if your cortisol levels are elevated, they help to bring them back within the normal range. And so, we already talked about why that's important for fertility and for addressing chronic disease risk in people who have experienced early life stress. And then also, I recommend processing any unresolved grief or trauma that people may be carrying
I like
from
it.
their past. Yeah, so that they can move forward. And then also
Exactly.
identifying and working toward changing any harmful thought patterns that may be affecting your relationships and your life. So those are the things that I typically recommend for people who have experienced early life stress and are wanting to conceive, right?
Daniel, I like the fourth point.
Mm-hmm.
Many of I'm telling you, 90% of my clients have work-related issue. Can you believe that?
Mm-hmm. Mm. Interesting.
Because they are really fussy about their work. They have to go to work. They have lots of loads on their work, and they don't get too much rest. They
Mm-hmm.
always stressed because they don't like commuting, and at their bottom of their heart, they even don't like that work. And
Mm-hmm.
that makes them stressful. That's why they cannot have their baby, because most of their energies goes for their work rather than creating a baby.
Mm-hmm. Yeah, makes sense. Mm-hmm.
Yep.
Okay, let's see. And then this is my closing thought here. So I just want to say this to your audience. Dealing with impaired fertility can be very stressful, and it's possible for us to be so focused on the end result that we miss the beauty in the process. And I know it can be cliche. I know a lot of people say this, but it really is true. There's a reason why people say this. So while trying to conceive, I recommend doing all that you can to focus on bettering yourself, mind, body, and spirit, so that you'll be prepared to receive the baby and to give him or her the very best environment when he or she arrives. Because we have to think about it, our bodies are really going to be the home for this baby for 9 months. And the research really shows that the effects, that whatever is going on internally in our bodies, can affect the developing child. And so if we're highly stressed and things like that, that can affect the child. If we are depressed and things like that, or anxious, that can affect the child. So I recommend, just really taking the time to work on you and trying not to be too stressed out about the end result, but just really, taking every day as a gift, and just, like going through life day to day, and just preparing yourself to receive the blessing that's going to come in the form of this child.
Beautiful, beautiful.
That's
Thank
all
you
I
so
wanted to
much.
share
Yeah, I
today.
love it. Beautiful. Can I ask you a few questions about naturopath?
Yeah, sure.
um, let's say, look, who come to you? Like, as a because everybody first goes to medical doctor when patients are referring to you. I
Mhm.
just want to know, because how do I know that I have to go to naturopath doctor, and what capabilities they have, how they can help? Yeah.
Mhm. In all honesty, the people who come to me, and I believe that is probably true for most of my colleagues, are going to be the people who have tried everything else, and they have not been able to find a solution. So we really work with the people who, can be viewed as like the most difficult cases, because people don't really know about naturopathic medicine. So you have to really be in a state of, like, I guess you could say, like a state of desperation. Like, I have to find someone who can help me with this because no one else, has said that they can help me. And so those are usually the people who find my office and who end up coming to see me, the people who feel like they've tried everything. Unfortunately, now I believe that things like this are going to raise awareness so that more people can come and kind of, because naturopathic medicine is so beneficial is so good at addressing things in the beginning. It's unfortunate that usually we don't get to.
Unfortunately, they waste a lot of time.
Yes.
And spend a lot of money, and when they don't have anything to spend, and they go other.
Absolutely true.
So, naturopath, do you do acupuncture as well, or as a part of your practice?
So we were trained in acupuncture, but I do not do acupuncture in my practice. Many naturopathic doctors do acupuncture.
I know a lot of naturopath doctors do acupuncture. They are trained as functional medicine outside the naturopath. So I know naturopathic and functional medicine are very similar. They do a lot of things together, but naturopathic, of course, it's more trained because they study more than functional medicine. Still, I don't know the distinguish between them. I know about the naturopath. You help the body heal itself. And you try natural remedies for it. But what is the distinction between functional medicine and naturopath?
The distinction is really going to be in the training that's received. So with naturopathic medicine, you're learning about these naturopathic therapeutics throughout your years of medical school, whereas functional medicine usually is usually you're going to do some kind of program outside of your official education. So you don't really learn functional medicine in allopathic medical school. So that's the difference. But the reason you're confused is because there is a lot of crossover. So
yes, exactly.
Yeah.
Can you stop sharing your screen? Then we can.
Yeah, let me figure out how to do that. Oh, okay, stop share. Okay, there we go. Yeah, so there's a lot of crossover. Functional medicine is supposed to, it's concerned with finding I guess you could say the identifying whether or not something is functional. So it's not like, it's wanting to get to optimal health, whereas naturopathic medicine, like the premise is, okay, we are trying to work with the body to restore it to a place of health. It's the same thing. People use the terms interchangeably. I think the biggest difference really is in how you got the training. So the difference would be with the provider and not with, mostly with the provider. And
the medicine you're using, because I know about the homeopath as well. A lot of naturopath doctors use homeopath remedies in their practice. Do you also do it, or you have your own remedies?
Yeah, so I don't use homeopathy either, but I was trained in homeopathy, and I believe that well, at least at my school, we had very exhaustive or extensive education in homeopathy, and a lot of people use it. I personally don't use homeopathy just because I have other tools that I like to use to help, that I am able to use more reliably. Like I really love botanical medicine. That's like one of my favorite things, is like herbs and different things like that, and nutrients and things like that. So homeopathy is not something that I'm not averse to it, but it's just not something that I make a habit of using in my practice.
So not everybody has its own practice in place. I had another lovely lady, and she actually doing the naturopathic medicine, And she also founded Bowen College. I don't know if you know her in Vancouver.
Mm-hmm.
So she actually practiced another thing addition to naturopathic.
Okay.
So you see, everybody should find her way, but the point is about the holistic medicine. What I realized, and I really experienced it in my own problem,
Mm-hmm.
and you don't need to go try so many things and at the end of the day go to naturopath doctor.
Yeah.
And if I knew that, really
Mm-hmm.
I didn't spend so much money on IVF.
Mm-hmm.
I'm not saying IVF is bad or good, because if your body is not ready, if you have underlying issues like, as you say, thyroid or anything else,
Mm-hmm.
so IVF doesn't work for you, and then you spend so much money.
Yeah.
And the problem is lots of people unfortunately repeat the same treatments over and over again
Mm-hmm.
without any cure, um, any curing for their underlying issues. And that's the
Right.
point. They never can be treated. They
Mm-hmm.
just hope that maybe IVF work.
Yeah.
But I've seen there are lots of IVF warriors. And one point they say, I'm going to stop. I'm going to go and check what's the problem with my body. Then they check that, oh, they have gut issues. They have, they have liver issues. They have a lot of like underlying. And then after surgery or after treatment, they could get back to IVF. And I
Mm-hmm.
know a lot of them could naturally conceive.
Mm-hmm.
That's interesting.
Yeah.
Janelle, I'm so happy and glad. I'm so, grateful to have you here. And hopefully this is going to be warning to many fertility warriors to understand that there are lots of ways, and that's the time to go and search for yourself
Mm-hmm.
before going to expensive treatments. It's better you work hard on yourself first.
Yes.
If it's better you do a total checkup, the whole checkup. Let's say if somebody come to you from the beginning, say, okay, I'm like 40-year-old, I'm going to get pregnant. You definitely do the thorough checkup for her
Mm-hmm. Yeah.
before even wasting time to go to fertility clinics or any other places. They may get naturally conceived.
Mm-hmm. Yeah.
They don't need to do all the expensive stuff. Or if they don't have any other resort, like they definitely should go to IVF to do this, then at least they know where is the problem, and after recovering from that problem, then they
Mm-hmm.
go to IVF or other treatment.
Yeah. Yes, and make actually conceiving or having the baby more likely, right?
Yes. Thank you so much for having us.
Yeah, thank you for having me. I really appreciate the invitation, and it's definitely been a pleasure.
Yes, thank you. Please subscribe to Panta Calhoun Transition channel and order my book Naturally Conceived through Amazon. Thank you for watching.